Last video, we have talked about peripheral artery disease and symptoms. This video, we will cover treatment options and prevention. Treatment for peripheral artery disease may include lifestyle changes, medicine, and surgery. Lifestyle changes can help improve symptoms, especially if you have early peripheral artery disease. The most important lifestyle changes include: don't smoke or use tobacco, get regular exercise, eat a healthy diet. Medications. If you have symptoms or complications of peripheral artery disease, you may need medicines. Medicine to treat peripheral artery disease may include statins. These are medicines to lower bad cholesterol. They help reduce plaque buildup in the arteries. The drugs also lower the risk of heart attacks and strokes. Blood pressure medicines. Uncontrolled high blood pressure can make arteries stiff and hard. This can slow the flow of blood. If you have high blood pressure, your healthcare professional may suggest medicines to control it. Ask your healthcare team what your blood pressure should be. Diabetes medicine. Diabetes makes you more likely to get PAD. Talk with your healthcare team about your blood sugar goals and how to reach them. Medicines to prevent blood clots. Reduced blood flow in peripheral artery disease can cause blood clots. Aspirin or another medicine, such as Plavix, may be used to prevent blood clotting. Leg pain medicine. The main medication used for leg pain, typically over-the-counter, non-steroidal anti-inflammatory drug, like ibuprofen, Advil, Motrin, which can effectively reduce inflammation and pain in the legs. A medicine called cilostazol can be used to treat leg pain in people with peripheral artery disease. The medicine increases blood flow to the area. Surgery. Sometimes a surgery or other procedures are needed to treat peripheral artery disease or its symptoms. Thrombolytic therapy. If a blood clot is blocking an artery, medicine may be given directly into the affected artery to dissolve the clot. Angioplasty and stent placement. If a narrowed artery is causing leg pain, this treatment may help. A tiny balloon on a tube, called a catheter, is placed in the artery. Access typically from femoral artery, brachial artery, radial artery, or popliteal artery. The balloon attached to the catheter inflates, which makes the artery wider. This improves blood flow. A small wire mesh tube, called a stent, may be placed in the artery to keep the artery open. Atherectomy. Atherectomy is a peripheral intervention that opens arteries blocked by plaque. During atherectomy, your provider uses a catheter, a long, narrow tube, with a rotating device on the end to scrape away, dissolve, or break up plaque without making a large incision. Bypass surgery. This surgery creates a new path for blood to flow around a blocked or partially blocked artery. A surgeon takes a healthy blood vessel from another part of the body. The vessel is connected from the healthy portion to the area below the blocked artery. The new pathway improves blood flow to the affected area. There you have it. Again, if you have leg pain or other symptoms of peripheral artery disease, make an appointment for a health checkup. You may need to see a doctor trained in blood vessel diseases, called a vascular specialist. What you do for the appointment. Write down any symptoms you're having, including any that may seem unrelated to peripheral artery disease. Write down your medical information, including other conditions you have and any family history of heart disease. Bring a list of medicines with you to your appointment. Include supplements and any medicines bought without a prescription. Also include dosages. Ask a family member or friend to go with you to the appointment if possible. An extra person can help you remember details from the appointment. Write down questions to ask your healthcare team. Thanks for watching. I will be back with more procedures tips on AngioSavvy.